boy. Okay. Hello everybody. My name is Danilo Castro and we're going to explain what is the APGAR score. APGAR score is an acronym and what it means. APGAR is apperance, pulse, grimace, activity, and respirations. And involved to results, APGAR. APGAR is a scoring and is a tool used to quick assessment to a newborn health status after birth. It is important you know how to calculate APGAR score when given a scenario in that nursing intervention to provide based on that score. In rare case, the test will be done 10 minutes after birth. And now, who invented that? Virginia APGAR introduced the APGAR score in 1952. How the test is performed? Okay, the APGAR test is done by a doctor, midwife, or nurse. The direction of the baby is breathing effort, heart rate, muscle tone, reflexes, and skin color. And that we have to hear. Apperance is male. Pulse, the heart. Grimace, what is the muscle tone and reflexes and activity. Yeah, I have to the muscles. Respiration, we have to how is the baby's respiration now and after his birth. And, and this is all. We have here the scoring and near to 3 is a critical low, 4 to 6 we have the fairly low, and 7 to 10 is generally normal. To conclude the information, the APGAR test is a quick test performed on the baby 1 and 15 minutes after birth. The first minute scores determine how well the baby tolerates the birthing process, and the 5-minute scores tell the healthcare provider how well the baby is doing outside the moment womb.
Breathing effort. If the infant is not breathing, the respiratory score is 0. If the respiration are slow or irregular, the infant score is 1. For respiratory effort, if the infant cries well, the respiratory score is 2. Now we have the heart rate is evaluated by a stethoscope. This is most important assessment. If there is no heartbeat, the infant score is 0 for heart rate. If heart rate is less than 100 beats per minute, the infant score 1 for heart rate. If heart rate is greater than 100 beats per minute, the infant score 2 for heart rate. Thank you.
Now I'm going to explain this next score. The muscle tone. If the muscles are loose and fluffy, the infant score is 0 for muscle tone. If there is some muscle tone, the infant score is 1. And if the active motion, the infant score is 2 for muscle tone. The skin color. If the skin color is pale blue, the infant score is 0. If the baby is pink and the extremities are blue, the infant score is 1 for color. If the entire body is pink, the infant score is 2 for color.
And now, we have the last point of the APGAR scores, the grimace. The grimace response or reflexes irritability is a term describing response to a simulation, such a mild pitch. Okay, if there is no reaction, the infant score is 0. If there is grimacing, the infant score is 1. And if there is grimacing and cough, like sneeze or bicterious cry, like very strong, the infant score is 2 for the reflex irritability.
APGAR score is the first medical evaluation of infants and occurs in the first minute of life, and then is repeated after 5 minutes from expulsion. APGAR score was named after Virginia APGAR, who first proposed, in 1953, this score as a way to evaluate, in measurable and quantitative terms, the health of the newborn. APGAR score is used today in all modern hospitals. Baby's medical evaluation is done based on 5 parameters, which are breathing, heart rate, reactivity to stimuli, muscular tonus and skin appearance. These parameters will be marked with a note from 0 to 2, each, summing in total a score from 0 to 10, called the APGAR score. Heart rate, pulse. It is estimated on the number of heartbeats. 0 means absence of heartbeat. 1 means less than 100 heartbeats per minute. 2 is more than 100 heartbeats per minute. Reflex excitability, grimace. Reflex excitability or reflectivity is the response of the newborn to external stimuli, is estimated by response that appear when the probe is placed into nasal cavity to release the airways. 0 means does not react. 1 means makes a grimace. 2 for screams, coughs or sneezes. Skin color, appearance. Skin color is important because it reveals the degree of oxygenation of the blood. 0 is pale or blue skin. 1 is pink trunk and blue extremities. 2 is pink skin. Breathing and screaming. Breathing. It is estimated the occurrence of spontaneous breathing, reflected by a scream or cry, and the presence of vigorous respiratory movements. 0 is absence of breathing. 1 is irregular breathing movements, weak cry. 2 is regular breathing movements, screaming or crying vigorously. Muscular tonus, activity. It is estimated based on active and passive movements. 0 means muscles are flaccid. 1 means some flexion movements of the extremities. 2 means present active movements, muscular tonus is good. Making APGAR score of a newborn at 1 minute after the expulsion will help the doctor to determine if the baby requires urgent medical assistance. If the infant accumulated APGAR score between 7 and 10, means that it is healthy and require only standard care. APGAR score located between 4 and 6 indicate that the infant has trouble breathing. This situation can be remedied by massage and oxygen. If a baby accumulates a score under 3, that shows a poor general condition and requires intensive care. However, keep in mind that a low APGAR score obtained in the first minute of life does not mean that the infant will not feel better over time. Children who are born prematurely or by cesarean section usually record a lower APGAR score than the baby born naturally.
And thank you for watching our video. See you later.